So you work with people with TMJ problems, and they have migraine headaches, grinding their teeth, things like that. So what is the treatment option for this?
The treatment options that we practice in my office is a neuromuscular dentistry, which is a branch.
Neuromuscular dentistry.
Neuromuscular dentistry. So it's a branch of dentistry that specializes in realigning the jaw into a more physiologically relaxed position, sort of rebuilding the bite to a more physiologically relaxed position. So what it does, people that have been suffering with headaches for years, people come in on the daily basis. We get patients that come in, they say they have headaches, they have muscle soreness, they have facial pain, they have neck pains, they grind, they clench, they have ringing in the ears. There's a list of symptoms associated with the bad bite. So again, through the state-of-the-art equipment that we have, we hook them up on the computer. We realign that
You put
jaw.
like things on their face.
Yes, we put myotrodes on their face that tell us, we look on the screen and we see where is that position when the muscles are relaxed, where the joint is functioning properly. We make the custom fitted orthotic in order to place patient in that position and try to get rid of all the symptoms that they came in with.
And their pain, their headaches?
Goes away. Sometimes
Really?
Instantaneously.
Yeah,
Sometimes we place the orthotic in and the patient comes back next time. We usually see patient a day or two after and they tell me, I'm feeling better. That headache went from 5 being the most excruciating to maybe 2 or 1, and then with time tends to go away.
Is that right?
Yes.
And now, what about somebody that's had migraine headaches for 10 years? Have you helped those kind of people?
Yes, yes. They've seen every doctor on the planet. ENT, neurologist, you name it, they've seen that doctor. They couldn't help them. In fact, neurologists, what they do, they just put them on medication, heavy-duty medication with a lot of side effects. So we bring them in, we hook them up on the computer, we figure out, yeah, there's a bite issue. The muscles are tense.
So there's nerves right here.
Yes.
So if your teeth don't come together, they're tense?
They're tense. It sort of compresses the joints. It causes the muscles to spasm, and that, in fact, causes majority of the headaches.
So you relax those muscles?
Yes, we do.
And their symptoms go away?
Their symptoms.
That's kind of a simple
We
way.
relax their muscles. We rebuild their bite into that relaxed position that we find, and then gradually the symptoms go away. As a recap, how do you know you have a TMJ problem? Let me tell you, every patient that comes through my office gets screened for the bite issue. So if your hygienist is telling you that I see the signs of grinding, I see the signs of clenching, I see the signs of teeth breaking down, look for help. It might be a bite issue that causes that.
So you can tell by looking at what the teeth are more flat if they're grinding, obviously?
Yes.
And it's because why? I mean, why are they grinding? Do you have a simple reason or answer for that?
One of the reasons is, again, if the teeth are not set up properly in the bite position, it causes the muscle to spasm and people start to grind.
So when you're asleep, what, you're trying to find a comfortable spot for your teeth to come together?
That too, or sometimes people that have sleep apnea and airway issues, it starts to clench, because by clenching it sort of opens up the airway, let them breathe. So a lot of people that have sleep apnea problems tend to grind and clench their teeth, and that simply destroys and breaks down teeth.
So this can be an easy one to fix for many people.
We can definitely address that, we can diagnose that, and if it is related to whether it is sleep apnea, whether it's related to the grinding and clenching, we can fix that. We can rebuild the bite and save teeth, basically.